Hi. This is the part two of the health psychology introduction lecture, and this is about the content. So it answers the question, what is health psychology about? What are the phenomena that it describes and tries to influence? So let's start, as you already heard about, with the definition of health psychology. And I use my own definition. Health psychology concerns all psychological processes that are directly or indirectly related to the causes or consequences of physical health and illness. Physical health and illness. Okay, but this is my definition. I like this. But there are others, like from the World Health Organization. It says health is a state of complete physical, mental, and social well being, and not merely the absence of a disease or infirmity. So that's very broad. It's also a high standard. It's a complete physical. So when you are not completely physical, mental, social well-being, then you're not healthy, optimal. Well, of course, it's meant well, and there's a lot of interesting points here to make that it's beyond the body. Then the second definition here is that of positive health. And this is, well, let's say roughly 10 years ago, this origins from medicine. And there was a doctor who thought, well, I think it's more about adaptation. And therefore, it's defined as the ability to adapt and self-management in the face of social, physical, and emotional challenges. The ability to adapt. Or is that health? How healthy are you? How is your health? All right. And so when I ask people, how's your health? They almost all they talk and they understand this. How is your physical health and functioning? Yeah. So that's why I choose to have this more narrow definition of the phenomena related to health psychology. And of course, there are also consequences of illnesses, like feeling pain and quality of life. Those are as important. Yeah, but the phenomenon primarily is the physical body, and then of course all psychological processes related to that, and that's more broad, of course. So, and this is another way of looking at health psychology. There is the health psychology music. Well, that's the video on YouTube, and it says that health psychology is sympathetic and it's prophetic. It's sympathetic in the sense that it wants to help people, just as clinical psychology. It has a warm heart, but it does this with scientific knowledge, and therefore it's prophetic in the sense that it tries to predict and tries to influence and then predict changes for the good. Yeah. So we have then three issues here. When you behave unhealthy, and that's about determinants of behavior. When you feel sick, well, that's about coping with illness. And when you need a coach, and that's changing the behavior. And again, you listen to the music, you will see this structure, this identity of health psychology again. And again, as I said in the first video, first part of the introduction of this course, theories are not vague or uncertain possibilities, but formal descriptions of phenomena that are not easy to observe. You must apply theories to understand and influence phenomena. So let's take a look at that human body. The human body is built up from several physical systems, like the muscular system, the nervous system, endocrine system. And all those systems, well, they have an optimal functioning. and a not optimal functioning. So without having a disease, there is still variance in how well the systems function, how well your lungs are functioning, how well your intestinals are functioning. And also all of these systems, they can develop pathology. So illness in many ways, in many types of illnesses, each of those systems. And this physical body that can be maintained and can exist only under certain conditions. So there is a mapping in the DNA, and this DNA organizes all the proteins and all the other things and chemicals in the body that builds the physical body. But this is only possible when certain conditions are met. And that's, for example, is we need oxygen, and we need the right food, and we need physical movements, exercises, and we don't need radiation and so on. So we know all those conditions. And for a part, those conditions are related to people's behavior. So people can set and guard the conditions for a well-functioning body without pathology to a certain extent. So here we see it in another way. We see at the left the green person is healthy, and this person can be exposed to pollution, to diets, to infections, to smoking, to all other things. So those things are all related to behavior. What does this person do when it comes to muscle activity? Do you go living in a neighborhood with pollution? What is your diet? Do you smoke or drink? And so on. So that's the psychology underlying the behavior. And at the right, we see the unhealthy person, the patient, the ill person. And by the way, we all are potential patients. Maybe you are a patient. Well, at the least, we will all become ill once in our lives. Most of us will become ill in our lives. And then there are other tasks like coping with the illness and taking medication. What do you think about medication? Healthy diet. We need social support, and maybe that you need physical activity to adapt to your illness. So this is another way of looking at, and then we see that there are health psychology is relevant for healthy people, but also for unhealthy people. And of course, there's a huge overlap. So let's take a look at what people die from. And here we see from left to right, we see the ages. So we see that those are the younger people and those are the older people. And what we can see is that there's a lot of blue. Let's say above 60, 65, the blue is increasing. Well, those are things that are not heart diseases and cancer. For example, like Parkinson's disease or different dementia types, but also infections. And then we see here that a proportion, those are proportions of course, also that the heart diseases, they increase the number of people who die from heart diseases. And then you see, interesting, that the cancer, after the number of people, there is a time when you're 90, let's say 80 plus, then the chances to die from cancer are lowered. Yeah. So we have those three clusters, and certainly heart diseases and cancer can be influenced by our behaviors, but also now we know nowadays to a certain extent can also influence the other categories of the causes of death. And then we see this, well, list of lethal behaviors or states that are related to behaviors. Like smoking is responsible for about 15% of early deaths. Saturated fat consumption, 5%. Low intake of fruit and vegetable consumption, 4.7%, and so on. Sedentary behavior, alcohol use, high blood pressure is not so much a behavior in itself, but it's related to several behaviors like getting tested, taking medication, salt consumption, and so on. Serious overweight, high cholesterol. So roughly 45, max 50% of people who die, they could have died later. They could have lived longer because of those behaviors. So let's see still about what is health psychology. And then when it comes to the people, healthy people, we see that party using drug is an issue. Radon testing, that's in the new housing, there is radiation going on. Unsafe sex as a behavior. Screening behaviors, for example, for sexual transmittable diseases. Smoking tobacco or weed, whatever. Alcohol consumption, food consumption, stress response, sun exposure, sedentary behaviors, and many more things are relevant to health psychology for the healthy people, or let's say for people in the phase in life in which they are healthy or partly healthy. Then for the ill people, things like symptom perception. What do you feel from your body? What do you think about certain treatments? How do you cope with your illness? How do you communicate with your doctor? Do you have social support? What do you think about your illness? Do you follow the prescriptions? Are you able to accept the deterioration of your body? Quality of life, death, all those issues are also part of health psychology. But before people get ill, we can do some prevention measures, and people can behave in a preventive way. And we can look at that in different ways. One now somewhat more modern way of distinguishing different types of prevention is this one. It's universal prevention. And this means that everybody in the general population can be exposed. This is about for people having a job, for safe traffic regulations, all those things that all people are exposed to, just to prevent all kind of illnesses and accidents. But there's also selective prevention. And then we look at exposure on the basis of risk factors. It may be that, for example, some gender has a higher risk for a certain disease. Well, then you can target this gender. Or we have indicated prevention. That's the early detection, but still no formal diagnosis. Like when people have some complaints about their body, then you can very in a targeted way, or actually in the indicated way, you can try to prevent further escalation of the disease and exacerbation or even development of the disease. Yeah, so these are different ways of preventing. And prevention from the health psychology point of view tries to influence behavior. So health psychology is for a large part by understanding the psychological factors in order to come up with interventions, with solutions. Those are the ways we reach people with health psychological interventions through labels on specific products. Well, that's interesting because everybody who has the product also should see the label. Information signs, stickers, we can do health warnings or whatever ways to influence people on billboards. And of course, you get only a segment of the population. We have leaflets. We have self-help books, magazines, newspapers, CD-ROM. CD-ROM? What's that? Well, that's the old-fashioned circle thing with information, of course. Email, podcast, internet, through influencers we can reach people, through smartphones. They provide all kind of monitoring gadgets. Through television still, radio, lessons, lecture, counseling, also through AI, group training, regulations, law, environmental changes, and press conferences. We saw that in COVID time, that this was also an interesting channel to influence people, to reach people. And don't underestimate this, the environmental changes, because that's a structural thing that will help to maintain people's health by structuring their healthy environment. Here we see some examples of interventions, like this is on a package of cigarettes. This is an environmental change issue, of course. You might change this to be more prominent. In one way, you might change the color or the attractiveness, or have some arrows point to it. So when you want people to take the stairs, and that's good for physical health. But also this. So we see that there are different ways of reaching people for the good. So do those things work? Do our interventions work? Well, yes. In general, you can say yes, health psychological interventions work. But let's take this case, and you will learn more about that in this course. But then let's take this case, and this was at the height of the corona crisis. So, and the question was, do people adhere to behavioral rules that were prescribed or suggested by the government, and also by other people? Now, washing hands when necessary from COVID. You see that not everybody, but still many people, they wash their hands. Washing them more than 10 times a day. That's less. Well, all in all, you see washing hands thoroughly 20 seconds, almost don't. We see that no more than 6 visitors. Well, that compliance was high. And also not shake hands. So those were the most successful regulations, you might say. But here you see that about half of the people indeed adhere to the advice of not visiting busy places and keeping 1.5 meters of distance. Well, you see, although the rules are clear and government meant well, still many people did not engage in the recommended behaviors. And this is not without consequences, by the way, because let's take a look at this graph. So there was an infection, and here we see a lockdown threshold. This means there are so many people and the danger is so high that there needs to be a lockdown. So this is what it could have been. Yeah, those are the contaminations. And then imagine that people indeed would adhere completely to all the rules. Then it's just a biological, epidemiological law that then the epidemic just would stop spreading. There's nothing left to spread. And then we would be below lockdown threshold and there will be no contamination. So there's no need for lockdown anymore. And this is all because people adhered so well that the number of contaminations went down below the lockdown threshold. And that's what could have been. But this is what actually happened. So there were a lot of contaminations, and people, all right, they adhered somewhat. Yeah, many people did, but not all. And therefore, the contaminations, they remained above the threshold of the lockdown. And therefore, we had to have a lockdown. Well, I don't say that I favored it, but then the government came with the lockdown. So this is what it was. So as you saw here, high adherence, then, and that's a blast, of course. That's not easy. But then we can prevent the lockdown. Low adherence, yes, then you still have a lot of contaminations. So we see that in this analysis, in this psychological behavioral analysis, the adherence is essential for the epidemic. Okay, and there was another interesting thing with there were many interesting things in the pandemic of COVID. For example, one of physical symptoms. Here you see, for example, there are some different physical symptoms: red eyes, throat pain, running nose, sore muscles, fatigue, cough, fever, loss of taste, breathing problems. All right, so when you have this or one of these, do you think you are that you have COVID? Or is it the flu? Is it COVID? Is it an allergy or just a cold? Oh, that's a puzzle. And there is a lot of uncertainty going on here. And that's one of the reasons why people might not have adhered to the rules. Just a lot of uncertainty, a lot of probabilistic relations. And those are the environmental things that were applied in COVID time. All kind of indications and labels and arrows and measures, and they all influenced people. And again, not all people followed those recommendations. So, and this is one last example what happened then in 2021. So that is already 5 years ago. And this was one of the slides that I showed then in the lecture of health psychology. And it said, as ventilation is one important measure, the windows of the lecture hall will be open during the whole lecture. In addition, I ask you the following. Please, so this is a message for students in the health psychology course. 1. In preparation for each lecture, do everything you can to make sure that you are not infectious for fellow students. Get tested. The university provides test kits. Do not join when you have physical complaints. In the lecture hall, respect each other's wishes to keep distance or wear face mask. Keep 1.5 meter distance from your lecturer. Ooh. If you discover soon that you had COVID, notify your lecturer immediately. Well, so those were some rules in the lectures at that time. And, this is all meant to regulate behaviors. So here we assume that people know that you have reasons indeed to engage in those behaviors. Only then it can be effective. There is one article, you will find it in the course information, that is about psychology in the COVID pandemic. And you will see it's all over. Medical doctors, epidemiologists, and virologists were prominent on television. But, it's not the virus that behaves. It's not the virus that flies or travels by train to another city. No, it's human behavior that spreads. That's the core of the moving of the pandemic, of the epidemic and the pandemic. So it's psychology, and there's also a lot of solution in. Therefore, there's a lot of solution in the psychology. So here you can see how rich the psychological perspective is, and how powerful it is, and how we can't miss psychology in something important like the COVID crisis. And then there's another article that provides another interesting perspective on health behavior. And this article is specifically about obesity, but actually it probably to a certain extent is relevant to all health behaviors. And this article says that, all right, obesity, having a lot of fat on the body, that is a problem. It's clearly a risk factor. And many people are obese in our societies, and it's increasing. But you can't only blame the individual for eating behavior. Well, that's the actually whole message. And this article provides an interesting, 7 model of population obesity. For example, one of the things it shows is that genetics are important in obesity. And here, let's take a look at this. I just summarized the literature, but there are genes that code for food preferences. So some people, they like more like the salty or the sweety foods than others. It's partly in genes. People differ genetically from their reward system, how it works, how sensitive it is. People clearly differ in the genetics of impulse control, in neuroticism, so the negative emotions they have, in the satiation feeling when they have been eating, in the hunger feelings they have. So those things are all related to genes, to sets of genes. And those can lead to more eating. And more eating is together with physical activity and metabolism genes, it's related to the energy balance. Yeah, because also the eating behavior is related to this arrow, by the way, should go there. This is a wrong arrow. It should be here. So this arrow goes to the energy balance. And another thing is that people have genes for physical activity. How well is their body made to engage in physical activity, and how is their metabolism? And together, eating behavior, partly caused by genes, and also their physical activity, also partly based on genes, lead to a certain energy balance and leads to obesity. So this is a very different perspective. And that's also, and there will also be another article on obesity, and that also is relevant to this thinking. And again, this may be relevant for all health behaviors to a certain extent. So then let's take a look. And this is also related to that idea that, well, a person is obese, well, there's only one to blame. All right, you can blame. Yeah, but is that really, that doesn't take into account the complex causality around obesity. Yeah, and is that really a choice? And here we have a freedom of choice. So let's say we have a society in which people can choose a lot of things themselves. On the other hand, we have environmental restrictions. Okay? You can also build a society in which things are restricted, and there's little choice. In the extreme, there is no choice anymore. Yeah, and of course, when people do live in such a free environment in which over-sugared Coca-Cola is rather cheap, and when that you can alcohol, just buy it, and that you can eat whatever you want. There are no restrictions. Nobody's saying you should stop eating now, or there are no laws. Then you still can influence people by information, education, persuasion, or treatment. Yeah, those things are possible in a free society in which everything is possible, in which the government doesn't paternalize people. On the other hand, there is an environment. The government might decide to make a lot of regulations and laws. You can't smoke here, and and alcohol, we're gonna make it even more expensive, and so on. And we have certain technologies, and we're gonna change in physical environment, so there is no stairs. So government or other societal organizations, they can choose to completely design a society in which there is little choice. Well, so this is what those are important decisions to be made, and this is let's say the bigger picture. And let's see now, where do you think we are at this moment? Are we very free? Can we do actually everything? Or do you feel very restricted? Or are we in the middle? Well, you make up your mind. You observe around you what you can do and how free you are. Okay. One of the things I would like you to learn is to observe health psychology. Let's take a look at this photo. And then we should try to make a difference between what do we see, what do we assume, and what do we infer. So first, let's see. What do we see? I see two people. They look women. They smoke cigarettes. I assume that they inhale. They are standing outside because they have an umbrella, and I assume that its umbrella is not for the sun but for the rain. At least, well, they are outside. So those are most things that we see. I assume that there were some regulations that they couldn't smoke inside, and now they are exposed to people who are seeing them, who are watching them standing. So I infer and I assume that their bodies are, well, kind of addicted to smoking, because it's not for fun to stay there with your umbrella. You have to invest something in that, and to have all people scrutinize you when you are standing there, you have to have a good reason to go there, namely to inhale the smoke. Yeah? So I infer that they are kind of addicted and therefore find it important, and therefore they say, all right, it's okay that people see me standing here, that most people don't do this. I know that I am smoking and that's bad for my health, but still I do. I think that that's the dilemma that those people are in. Although it may be that they, within that assumption, there are different ways. They may be desperate, or they think, well, this is what I'm going to do every day here. Let's take a look here. What do we see here? I see a person, a woman, who is obese. I see some objective fat layer. And just to be sure, I don't judge about that. I just observe it. Yeah, that's essential. I don't judge. I don't say that's good or bad. I just see that the tightness of her clothes, that's also an interesting thing. What does it mean? Why does she wear tight clothes? And then I see at the background, I see two people, and it looks like they are scrutinizing, that they are looking at this person. What do they think? Well, I don't know. They are not laughing. And then we can assume that this person, the obese person, knows that the clothes are tight and that then the bodily shape is more prominent. That's what I assume, that this person knows that. Yeah. We can fantasize what's going on in the heads of those people, and both those people, the bystanders, are not obese as far as I can see, at least not severe. Yeah, so this is just seeing. It's clear what we see, and then assuming what they know and what they probably know, and inferring what they might feel and what their behavior caused. Let's see. I see that they take measures, and different types of measures. Those are important people. This is Macron. I'm not sure who this person is, but it undoubtedly is also a leader. And I see also at the background people also with face masks. So that's what I observe. And then I assume that they all find this beneficial in some way. That's why they do this. And I infer that they comply to social rules just for the social rules, or that they indeed find COVID dangerous. I don't know. What do we see? I see young people who are cheering and drinking alcohol. Well, actually, I don't see that it's alcohol. I assume, to be honest. So when I assume that this is alcohol, and well, it's a wine glass. Yeah, let's be clear about that. So when it is alcohol, then we might say that they see each other drinking. Yeah, that's why I infer from this situation. They know each other, that they are drinking, and this I know, this leads to a kind of social norm. So although we nowadays, at least the World Health Organization says that alcohol is bad, every glass increases your risk for illness. All right, well, you will probably talk in this course a little about whether that's true. Well, then this is an interesting thing, that there seems to be a norm and a cultural occasion in which it's legitimate and fun to drink a compound that in principle can lead to illnesses. And that's a far inference, of course, but that's what it's about. Yeah, but let's stick to what we see, and then young people who are having a good time together with alcohol. Here we see, let's see, I see a person in pajamas smoking, and I see a person in a surgery suit, or is it also a pajama? I don't know. Both are smoking. Yeah, and while it says here no smoking. Well, that's an interesting. So immediately we assume and we infer. We assume that they know that smoking is bad. We assume that they know that there is no smoking sign. Yeah, and so we might infer that, given this, they must have a need to smoke. Yeah, otherwise you have to have good reasons to inhale the tobacco. Certainly also in a place, and certainly also in a moment in life that you are ill. So again, what do you see, and how easily we jump to assumptions and inferences. And in this course, you will learn psychological theories that help you to come up with the right assumptions. Assumptions are hypotheses, and make the right inferences. Yeah, and of course there is always uncertainty, but that's what academics do. They work with uncertainty. When things are not so clear, you should be able to ask an academic, what do we do? Here, let's see, what do we see? I see a young man in a wheelchair with a young woman behind the wheelchair. Both seem to laugh. I see from their faces. And so what I infer is that one person, the woman, is helping the other, assisting. You know? They may have a relation, and of course I have many prejudices and assumptions already, and that's legitimate. That's a starting point. And they both, for example, they will have ideas about the causes of why he is in the wheelchair, and about what his quality of life is and how he feels. Yeah, but that's all about assumptions and inferences. Okay, so learning to observe is essential, because that provides you with lots of information. And together with your health psychology knowledge about theories, about the phenomena and the theories, it will help you to come up with the right assumptions and hypotheses and inferences, so you can check them and so you can act. Okay, well, that was the introduction in health psychology. In the coming 6 lectures, we're gonna go into 6 clusters of theories. Yeah, so you study the theories, study the literature. Also, do the e-training assignments. Well, it's mandatory. You will have to show that you've done them when you report on the assignments in Brightspace. And prepare your group meeting presentation. You do that by 1, doing your own assignment, and also preparing the theories that are assigned to you. That's something you decide in your group. So, as I said last time, please take the 2 main documents. Yeah, the course information document and the e-training document, and read them carefully. That will really help you to plan all your actions in this course, and then you should be able to have a sufficient grade. Yeah, all right. See you shortly in the first lecture. Bye.